This is a stimulus update and daily news report. Got some important updates to share with you. $7 per gallon. That's how much the price of gas could be this year in certain states. I'll let you know why. There are $1,827 checks going out to certain people, and I'll let you know the exact dates for Social Security payments for the month of January. We're going to hear from Bernie Sanders of how people need more help in America and what type of financial aid could be given, and I'll give you some other important updates as well. Hope you're having a more than mundane Monday. If you appreciate the fact-based, fast-paced updates, hit the like button down below and subscribe to the channel for more daily, straight-to-the-point updates on matters that financially matter to you. So let's get into this. Why low-income households are hit harder by spiraling food costs. Kind of makes sense. Almost doesn't really need much explanation, but there are a few good points here I wanted to point out. So essentials make up a bigger share of spending for low-income households. So according to the latest inflation report, the costs in October were 7.7% higher than the year before. Food at home has shot up 12.4% in a year, while energy savings increased 15.6%. That's rough for many families, and basically what it's saying is the majority of people's budgets, low-income budgets, are food. Or not the majority, but a big portion of it. And so if food prices go up, it's cutting into their overall budget and there isn't much money for anything else. Low-income households are less likely to have savings. So if any emergency comes up, basically it eats away at the savings. And according to data from the Federal Reserve, excess savings for the bottom income quarter decreased by 25% between the first and second quarters of this year. So with savings dropping, credit and debt is going to go up, and food is just hitting everyone really hard here. And then it's harder to reduce costs if you're already buying the lowest priced goods. I'm sure we can all relate. If you're trying to buy food and there's no other low food alternatives, there's really not much else you could do, especially since food is a necessity. So saying, for example, you might switch to store brand products or find ways to reduce food waste. But if you are already doing those things, it's much harder to beat inflation. Plus, it's also more difficult to buy in bulk if you don't have extra money to pay for the things up front. So for these reasons, it's saying that it's really hard for low-income households in general, especially when it comes to food. Will inflation continue in 2023? Well, we're seeing a downtrend. So inflation is slowly getting lower, but they're saying it's still going to get worse and there could be a recession. Some are saying it could be a short-lived recession. Nonetheless, recession is not good for anybody. Moving on, exact dates: increased automatic payments worth $1,827 and $4,194 go out in January. So for Social Security recipients, the COLA is going to kick in here in January. I'll let you know the exact date. So you already know if your birthday is the 1st to the 10th, it's the second Wednesday. If it's the 11th to the 20th, it's the third Wednesday. And 21st to the 31st, it's the fourth Wednesday. So the way the dates work out, January 11th for birthdays 1st to the 10th, January 18th for birthdays 11th to the 20th, and January 25th for birthdays the last third of the month. So yeah, those are the dates for Social Security payments. And then drivers could see gas prices surge to nearly $7 a gallon in some U.S. states as refinery issues bite supply and Chinese demand bounces back, according to Gas Buddy. So a few days ago, if you're watching, it said it might go to $4 per gallon. Now it could be as high as $7 per gallon. So could see some big spikes. Cold snaps across the U.S. and revived energy demand from China are two key factors that could push up prices. In 2023 is not going to be a cakewalk for motorists. It could be expensive, so according to Gas Buddy. So because if you think about it, China's economy was kind of shut down due to their policies and trying to reduce the illness. And now that the economy is opening up there's a bigger demand. That could be one of the reasons why gas prices went down. So now we're going to start to see it come up. So basically, curveballs are coming in every direction. What he said is, I don't think we've ever seen such an amount of volatility as we have seen this year. And that will be a trend that likely continues to lead to a wider uncertainty over fuel prices going into 2023. So it could potentially get worse. There is a lot of volatility in the world. world, a lot more than usual over the past few years, and over the next few months is not going to be different. When it comes to what is going to be done for the American people, what type of financial aid, what type of help could be for those who are struggling the most, take a look at what Bernie Sanders plans to do.
Let me take this opportunity to wish everybody a very happy holiday season and a wonderful new year. And what I wanted to discuss very briefly with you is the fact that I will soon be assuming the chairmanship of the U.S. Senate's Health, Education, Labor, and Pensions Committee, one of the most important committees in the Congress. And as I move into that position, which has very broad jurisdiction over many of the major issues facing our country, let me tell you what's on my mind and what kind of committee I would like to lead. And I also want at this moment to ask for your help, because in the final analysis, as I think most of you know, real change never comes from the top on down, not from Washington to the rest of the country. It always comes from the bottom on up, when millions of people at the grassroots level stand up and fight for what they need. But let me say a few words now about some of the issues that we will be dealing with. And let me start off with our dysfunctional healthcare system. And as I speak to you right now, I'm thinking about a nation that spends twice as much per capita on healthcare as the people of any other nation. We are spending some $13,000 for every man, woman, and child in this nation. That is an astronomical sum of money, and that is unsustainable. Meanwhile, we have worse healthcare outcomes than most other countries, including the fact that our life expectancy, how long we live, is lower than many other countries, despite the fact we spend so much more on healthcare. And of course, as all of you know, the reason for that is that the function of our healthcare system is not to guarantee healthcare to all people, but to make as much money as possible for the insurance companies. So in our country today, while the insurance companies make tens of billions of dollars a year in profit, we have 85 million Americans who are either uninsured or underinsured. We have almost 500,000 people every year who go bankrupt because of medically related expenses. And we have 60,000 people who die every year, if you can believe it, because they don't go to a doctor when they should. And if that's not a definition of a cruel and dysfunctional healthcare system, I don't know what is. Furthermore, we are living in a country today where drug companies are making huge profits while people split their life-saving pills in half because they can't afford them. And we have a situation today for elderly people where they can't afford to get the dental care they need, the hearing aids they need, the vision they need, because Medicare does not cover those very basic needs. And I can go on and on about healthcare, but the bottom line here is that what we have in this country is really disgraceful. And that is an issue together we are going to have to work on. We must have the courage to stand up to the greed and recklessness of the insurance companies and the drug companies. We have to substantially lower the cost of prescription drugs. And we have got to work to guarantee health care as a human right for all of our people, not a privilege. So that is a broad view of where I want to go on health care. Now, education is also within the jurisdiction of the Health, Education, Labor, and Pensions Committee. And today, when I think about education, I am thinking about a country where somehow or another we can afford to give massive tax breaks to the billionaire class, but meanwhile our teachers and our children exist in classrooms with broken chairs, flooded buildings, and inadequate staff support. And we're living in a country where many thousands of our teachers, and they are truly heroes and heroines, are inadequately paid as they do the best they can for the children of America. We're living in a country where hundreds of thousands of bright young people who have the desire to get a higher education, they can't do that because the cost of college and trade schools are very expensive and their families lack the money in order to pay those tuitions. And meanwhile, we have 45 million Americans who are now struggling with student debt. I'm thinking about a country today which has a wildly dysfunctional child care system. And any of you who have little kids, you know this. It costs on average over $15,000 a year to get a kid into a child care facility if you are lucky enough to find that slot available, because there are many parts of this country where it's very, very hard to find affordable, quality child care. So this issue of child care or pre-K is a major issue that we have got to work on because these little kids are the future of our country, and we cannot continue to treat them and their parents the way we currently do. So yes, overall, we have got to work towards creating the best educated workforce in the world, one that prepares our kids to succeed in a highly competitive global economy, one that recognizes that a high-quality public education system from childhood to adulthood is the right of all and not just the privilege of a few. So education from childcare through graduate school is an issue we've got to focus on. We have to make it high quality, we have to respect educators, and we have to make sure that all of our people, regardless of income, can get the education that they need and deserve. When we talk about a health education labor committee, obviously the needs of working people is very much on my mind. And today I'm thinking about a very rigged economy with an unprecedented level of income and wealth inequality. And that means that the middle class continues to shrink while the people on top have never had it so good. And the gap between workers and their bosses is now wider than it's ever been. The employers, the bosses now earn about 400 times more than their workers make, while workers, millions of workers, are trying to exist on starvation wages. I'm thinking about a country today where at this moment, workers all across this country at Starbucks, Amazon, nurses at hospitals, workers at factories, young people on college campuses, they are organizing unions in order to receive better wages and working conditions because they know at the end of the day, unity, bringing people together for collective bargaining in a union is the only way that many workers are going to get the wages and benefits and working conditions that they desperately need. But what's going on in America today is that these efforts, where workers are exercising their constitutional rights to form a union, they are being vigorously resisted by fierce and illegal anti-union actions from corporate America, from Starbucks, from Amazon, and from many other powerful entities. They are doing everything they can to deny working people the right to form a union, and we've got to deal with that issue. So yes, we must raise the minimum wage to a living wage. Nobody in America is going to make it on $7.25 an hour, which is what the federal minimum wage is today. We must stand up to the extraordinary greed and power of corporate America and make it possible for workers to organize unions. Now, I am not naive. I didn't get into politics yesterday, and I do know a little bit about how the U.S. Senate and U.S. House work. So I am not here to tell you that all that has to happen is that I assume the chairmanship, I bang my gavel, and lo and behold, all these important pieces of legislation get passed. It ain't going to happen that way, that's for sure. There are going to be a number of issues where Republicans and some conservative Democrats, sadly enough, are just not going to be supportive, and I understand that. But that doesn't mean that we give up on these issues. We're going to take these issues to the people. We continue the fight. And if we can't pass these very important issues today, well, we're going to lay the groundwork for doing it tomorrow and into the future. But in addition to that, I am hopeful, and I believe there are some areas where we can find common ground and make some real progress with some Republicans and with some more conservative Democrats. For example, the truth of the matter is that whether you're a Republican or a Democrat or an independent, no matter what your ideology may be, you know what? You can't afford the outrageously high cost of prescription drugs and insulin. So I hope that we can bring people together to lower the cost of prescription drugs. It doesn't matter to me what your ideology is. If you're a working parent, you can't afford $15,000, $20,000 a year on childcare. And millions of people are just unable to afford to send their kids to college. So I hope that we can create some kind of consensus. It may not be everything I want, everything you want, but hopefully we can create some kind of consensus to improve the situation that exists in education from early childhood up to higher education. And the truth is that, I don't care what your ideology is. You could be a right-wing Republican or a Democratic Socialist. It could be whatever you may be. You ain't going to make it on very low minimum wages, and we're going to raise that minimum wage, as I said earlier.
So what are your thoughts on Bernie Sanders? Do you agree, disagree? And that is all the news that I have for you today to hopefully cheer you up a bit. Here's my daughter Bella's tip of the day.
Hi guys, this is the tip of the day. Want me to tell you the one thing that you should do? You should, when you feel bad, take a couple deep breaths in and out. And also, after that, you can realize that things are better. So, bye.
Thank you so much for watching. Appreciate all of your support. So yesterday was a fun day. Just stayed in the house with the family, relaxed. So we actually made some sushi, which is pretty cool. We took out the sushi making kit, which we got as a gift. And yeah, just some rice, some seaweed, and we did carrot, celery, peppers, and I think avocado. Yeah, a little piece of avocado in there, and Bella was making it, which was pretty cool. So yeah, it was a good time. Hopefully you had a good time with holidays, spending with your family and stuff. Anyways, if you want to check out any of my other videos, or actually if you want to check out Bella's latest review on her school supplies, you can click right up here on my Wise Buys video, and I'll see you in the next video. Take care, be safe. Thank you for watching.